You wanted to know what possible long-term complications may result from having a C-section. And there are a few, there are possibilities, but the ultimate thing to keep in mind is that whenever a doctor is considering a C-section for a woman and her baby, they're always weighing out the risks versus the benefit, because they know that there are potential risks associated with it, and they don't want to subject the woman to that unless it's necessary for the safety and well-being of her and her baby at that point in time. When a woman does need a C-section, there are some possible complications that can result. One is an ileus or an intestinal blockage, and this happens in about 10 to 20% of cases. Others include possible numbness and tingling, endometriosis associated with scar issues. Some women also develop endometritis, which is the inflammation of the endometrial lining inside the uterus related to infection in most cases. 2 to 4% of women require a blood transfusion after a C-section because of hemorrhage. 1 to 2% of women experience wound complications, and less than 1% of women have surgical injuries. Now, there are definitely implications for future pregnancies, whether you've had 1, 2, 3, or 4 previous C-sections. A woman is at risk for abnormal placental attachment, like a placenta previa, where the placenta is attached over the cervix, or an accreta, where the placenta attaches too deeply or into more structures than it should, and it makes it hard to deliver after the baby's delivered, and can cause postpartum hemorrhage. Uterine rupture is also a potential risk, because every time a baby is delivered by C-section, the doctor makes an incision on the uterus, delivers the baby, stitches it up, and it heals nicely, but it's still a weak point forevermore, and that weak point on the uterus is tested during future pregnancies and especially labors. There's the potential for it to burst open, and when this happens, it's potentially life-threatening to mothers and babies. If you are having specific symptoms that you're concerned about that you think may have been related to a past C-section, don't hesitate to talk with your doctor, and based on their knowledge of your circumstances and ability to look up your history and ask more specific questions, they'll be able to give you tailored information and advice about what your symptoms are related to and whether that is from a previous C-section or not. And if you get pregnant again, ask your OB provider about what implications your pregnancy history will have on this current pregnancy. If you have more questions in the future for me, feel free to ask them on our Intermountain Moms Facebook and Instagram pages, and recommend us to your friends and family too.